I will call to order the meeting of the Chautauqua County Legislature on December 15th, 2021. Would the clerk please call the roll?
Under God, indivisible, with liberty and justice for all.
I will again ask for all those in attendance in the legislature chambers, please wear a mask. If you don't have a mask, we'll be happy to provide one to you. So then we will move on to our second privilege of the floor.
I will, but I can't wear a mask, all right? Good evening, my name is Kathy Abbate of Asheville, New York. I'm here to thank and encourage our county executive and those on this legislature who stood behind him in the decision to stand against the illegal and unconstitutional mandates and fines associated with noncompliance. I also appreciate that Andy Goodell and George Borrello also gave statements against these mandates. Please continue to stand against all forms of illegal, unconstitutional mandates, including vaccine passports. They are not what the USA stands for. My concern is, though, that I don't see our county actively pushing the early treatment approach that has been effective around the world to eradicate this bioweapon/virus. I want to encourage each of you as our elected representatives to research these protocols through the Frontline Covid Care Alliance group. It's an amazing group. You can find them out online. These doctors are not only helping people get these medications, but sharing data from peer-reviewed studies around the world. Why is this being ignored here in the USA? My conclusion is that there is much money to be made by the pharmaceutical companies with these vaccines and not much to be made with cheap, long-time, safe, and effective drugs we have used for decades. I would think it would be much safer and more effective to promote getting people the protocols as soon as they test positive. I know for a fact this is not happening. Those I personally know that have gone to the emergency room and tested positive are given prednisone, maybe an albuterol inhaler, sent home, and told if they get worse to come back to the ER. They then get admitted. These are the people that I know that have had that happen. They then get admitted to the hospital and many times end up on a ventilator. We could keep people from even entering the hospital by treating with ivermectin, hydroxychlroquine, inhaled budesonide, vitamin C and D, quercetin, zinc, Z-Paks, and corticosteroids if needed. These are being used very effectively by fearless, courageous doctors, and they have very few patients who end up in the hospital or die. Some of these doctors are Dr. Peter McCullough, Dr. Zev Zalenko, Dr. Pierre, Kory, Dr. Simone Gold, and that's just a very small amount here in the United States. There must be bold actions taken against the vaccine narrative to care for people's health. Continuing to promote a vaccine that has no long-term studies and has injured 1.8 million people in the USA, as reported to the VAERS, of which 20,000 of those are deaths, is, in my opinion, malfeasance. How would it feel if you told someone to get the vaccine and they died shortly after, or they were permanently injured for life? I personally know of three people who experienced severe adverse events right after receiving the vaccine. One of those people used to live here in Chautauqua County and is in Pennsylvania now. He got the vaccine. Within 1 week, he came down with COVID, ended up unconscious and in a coma for 4 weeks, and because of microclotting, lost both of his feet, his right hand, and several fingers. These stories need to be told. There are thousands and thousands of them all over the country and the world.
Excuse me, you've exceeded your 3 minutes.
I'm wrapping it up right now. I believe in freedom to choose what is best for your own body. If you have complete informed consent and you choose to take the vaccine, that's your choice. But please also start promoting early treatment and stop making those who choose to not take the injection feel that they are wrong in doing so. There is something very wrong with bribing people to get a vaccine. Let people make their own choice without dangling carrots in front of them. Thank you.
Good evening, Mr. Chairman, members of the legislature, Mr. Wendell. First of all, I'd like to thank Executive Wendell and this body for taking the constitutional motion passed a few months ago seriously. And again, thank you to Mr. Davis and Mr. Pavlock for putting that forward and everyone else who voted in favor of it. And thank you for having the courage to resist a return to government overreach to deal with this COVID situation. I think with nearly half the counties in our state refusing to participate in the enforcement of our interim governor's recent unconstitutional mandates, there appears to be hope that we're coming to our senses. Myself, many others, and perhaps some of you, especially from what I've seen tonight, have opined the extreme politicization around this virus and the tension and division that it has caused and is causing in our lives and in society. What I hope we've learned or will soon understand is that heavy-handed government mandates are not how we should deal with this type of virus. I believe as a county, you as a body, and especially Executive Wendell have an opportunity to demonstrate moral leadership and responsibility in taking some additional steps to further help depoliticize this situation. And I think that's the main problem that we face tonight, is that we started off, right off the bat, politicizing this virus. Wouldn't it have been nice if no politician ever grabbed the microphone and spoke about this virus, if only real scientists and real doctors were allowed to disseminate the information and keep the politics out of it, keep the politicians out of it? I don't think it's a putting the toothpaste back in the tube type situation. I think we do have an opportunity here, and I think we as a county can lead this if we're willing to be courageous and take a few next steps. And this is going to sound extreme, but I really think that we can do it, and I think it can be the next logical step that hopefully other counties will follow and help us, like I said, depoliticize this situation further. I think the county health department should cease spending public resources in the form of tax money and personnel for materials promoting vaccination, as well as running and administering vaccination clinics or drives. I am not opposed to people making the decision to get themselves or their children vaccinated. The issue I have is with government being involved to the point of using tax money that belongs to all of us for this purpose, which is clearly controversial and is fanning the flames of division in our community. Case in point, this meeting tonight. Another case in point, the Chautauqua County Health Department has had to pull and disable comments from their Facebook page regarding vaccination drives for children. The money used to fund our county health department is collected from a wide range of people with a wide range of strong opinions regarding the virus and the vaccine. To put it to use for things that are so controversial and so contentious is both immoral and irresponsible. Additionally, our health department is also responsible for services such as mental health, addiction treatment, as well as foster care.
Excuse me, you exceeded your 3 minutes, please wrap it up.
I'm speaking for the Libertarian Party as well as myself.
Okay, would you please introduce yourself and your address?
Oh, sorry, Mr. Chairman. Garrett Kane, Jamestown, New York. As a Libertarian, I'd gladly go to the mat, rhetorically, not literally, Mr. Wendell, in favor of these services being better handled by non-government entities. Yet at this place in time, it remains in the hands of the county and state departments of health for now. Vaccinations are readily available at primary care doctors and pediatricians, as well as most area pharmacies. We don't need to spend valuable public resources on max vaccination clinics and bring many people to one location, what some would call a risk for spread. In closing, I encourage this body and the executive to direct the county to cease participation in vaccination promotion and administration in the interest of using their resources to better address the issues of mental health, addiction, and foster care that are lacking in this area and throughout the state. Likewise, this is in the interest of depoliticizing the issue of COVID and vaccination. In good faith, the county could help those signed up for the upcoming vaccination clinic to schedule an appointment with their physician or nearest pharmacy. If we take this step, hopefully, similar to the recent state mandate nullification, other counties will take notice of our courage and follow our lead to get their departments of health refocused on less politically contentious priorities. It is my hope that we can de-escalate the emotions and the vitriol that is poisoning our government, communities, and families. That we can get to the point where government is restored to a very limited role, where our founding fathers intended it, into a society where people and their God-given rights matter more than politics. Thank you. Merry Christmas.
Good evening. My name is Anthony Toda. I live in Jamestown. And I appreciate, and I like to say it separately, the responses of our county executive and Assemblyman Andrew Goodell concerning for showing that the New Yorkers that Governor Kathy Hochul's mask mandate is illegal and makes Governor Kathy Hochul a ruling despot similar to the royalty of Old England, such behavior that sparked a revolution in free system of government that's being threatened right now by Kathy Hochul. Because COVID is a statewide issue affecting all New Yorkers, we have the right to be heard through our state representatives, through due process of law, as Assemblyman Goodell stated in the paper, for the purposes of establishing laws regarding COVID-19. Governor Hochul is disregarding HIPAA law privacy protections concerning our medical treatment and denying New Yorkers the right to make an informed decision as to treatment based on the reliability of the medical information. Further, Governor Hochul is tampering with the 14th Amendment to the U.S. Constitution and its companion in New York State Constitution, which protects the right to bodily integrity, or in other words, the right to do whatever you want with your own body. For these reasons and more, Kathy Hochul has exceeded the authority for executive orders allowed to a governor by federal and state constitutions, resulting in these orders being unenforceable and requiring Governor Kathy Hochul's impeachment. Governor Hochul is oppressing the other two branches of government and destroying the protection against someone like her given to Americans under the balance of power doctrines. Now, just for looking at Kathy Hochul's defense of promoting the general welfare, well, you allow tens of thousands of people in football stadiums every week. You allow people to go shopping in malls and plazas. Is that an intent to promote the general welfare? President Biden allows 60,000 illegals to cross the border every month. Those illegals statistically have multiple times the rate of COVID infection that we have here in the Americas. He then puts them on a plane and disperses them to the four corners of the United States, along with COVID-19 and other diseases. Is President Biden, is his intent to promote the general welfare, or is he failing to do his job as a president, being a hypocrite and allowing this disease to spread unnecessarily while oppressing the rest of us? Thank you.
Thank you, Mr. Toda, for respecting my request to wear a mask. You're welcome. So, thank you. Next, Legislator Nazaro.
Yes, thank you, Mr. Chairman. I'm up here not as a legislator, but as a lifelong resident of this county. I live in Jamestown, New York, Springdale Avenue. I respect all of you and I thank you for coming. You have the right of freedom of speech and I honor that. And most of you know I'm pretty bipartisan and non-political, so I'm not here to debate the political issue. What I am here to tell you, 24 hours ago, I was in the ICU saying goodbye to one of my best friends who died of the COVID. He refused the vaccine, his choice, freedom of right. He would not wear a mask unless he had to. Again, freedom of choice. He thought he could beat the COVID. Today, I went with his wife to Lynn's funeral home to help to make arrangements for his burial. Today also, I was at the Catholic Church saying goodbye to a close relative at a funeral who died of the COVID. Not a good couple of days for me. Thank you. And again, I respect all of you. What I'm here for is to do the right thing. We are in a health crisis. Over 800,000 people have died nationally. We can debate the issue. Sure we can. This county, we had 11 deaths last week. 2 weeks ago, we had over 800 new cases. This past week, I did not hear the exact numbers, but I heard it was close to 700. We are in a healthcare pandemic. And the reason I wear the mask, because I believe it's the right thing to do, and that's my right, but also I don't want to give this virus. I've been vaccinated, as you probably could guess, and if I had the booster, I was reluctant to get the booster, and I got pretty sick from it. But I want to protect my family. I want to protect my friends and my loved ones, the people I'm sitting here. So non-political, I'm not trying to infringe on your rights, but in my opinion, the right thing to do is get vaccinated unless you have a medical reason not to, and wear the mask, and let's get through this damn pandemic that is crippling this country and the world. Thank you for letting me speak.
I want to say I'm very sorry for your loss, and for anybody that has lost anybody due to the pandemic relating to COVID or any ailment whatsoever. Death is not an easy thing to deal with. I know I've worked as a nurse for a long time now, and I'm here to say that there's always going to be diseases that we are dealing with. And to put COVID aside, I'm not trying to speak of it lightly because it is a very serious thing we should take very seriously. But, yes.
I neglected to ask you to introduce yourself.
Oh, I apologize, Kory. My name is Kory.
And you live?
I live in Stockton.
Thank you.
Thank you. Sorry about that. I've never been to any political event at all. I am just now trying to get involved because of common sense. Things that are happening now, and actually since the pandemic has begun, common sense has just kind of gone out the door, and fear has set in. And what I'm trying to tell you is that our healthcare system has had a lot of issues way before the pandemic even started. I could tell you horror stories, horrific stories that I've experienced personally, working in the ICU, working in the ER, working on the med-surg floor, working in our community in all of our nursing homes in this area. I've been throughout every single area as a nurse. I apologize, I'm really nervous right now. What I wanted to say is that I know it's hard because we're all getting really emotional based on fear that our rights are being taken away, fear that we're going to die from a disease, from a virus. But we have to think logically about what is happening in common sense as a society right now. There are rights being taken away, but for what? It's out of fear right now. We have to think logically. As a nurse, I'm taught basic 101 nursing school to question things. I could tell you so many times, if I didn't question an order from a physician or another nurse or another medical professional, my patients would have died if I did not question it, use my nursing judgment. So this is what a lot of the people, a third of the population right now are doing. We're questioning the practices that are happening because they don't make sense. Just again, throughout the pandemic, I was told to not wear a mask at the very beginning, even though I was the one that started wearing a mask originally. And then it was, okay, wear a cloth mask, and then wear an N95. Oh no, now it's just surgical. Oh wait, now you have to wear an N95 and then a surgical mask. Now wear your face shield. Oh wait, now this week it's okay to just wear a surgical mask. I know it's just one silly example, but there's so many different things that do not make sense. And so as a healthcare professional, I have to question what is going on right now. And again, COVID is very serious and it should be taken very, very seriously. But we're missing just these very basic facts, and it's frightening what is happening. And to not allow healthcare workers in our state to not work because of a vaccine that we're questioning the validity of, that's just insane to me. So now all my experience as a registered nurse, my professionalism, and I'm not trying to boast myself by any means, but I can tell you my patients were well taken care of, and I could tell you of thousands of other nurses who are not working right now that need to be working to help advocate and take care of everybody's family members for COVID. I have a good friend in the ICU going on 3 weeks right now at Brooks, still there, related to COVID because her primary physician would not see them. They wouldn't take care of them. Why? Again, common sense to me, like I can't tell you what your lungs sound like just from looking at you. I have to be able to assess. Why are we not treating COVID patients? We would have a lot better outcomes if we just did a better job instead of forcing things.
You've exceeded your 2 minutes. Please wrap it up.
Oh, I'm sorry. Thank you for your time, and I hope everyone has a safe Merry Christmas. Thank you for allowing us to come and speak. Just please, try to open your minds a little bit more. We have to not think fear, fear, fear. And yes, we want to save lives, but we have to do it with common sense. Thank you very much for your time. I appreciate it.
Anyone else wishing to address the second privilege of the floor? Legislator Nebel.
These folks in the back here, look, many legislators are probably sympathetic to your views. Show me one resolution or one motion where this body has supported mask or vaccine mandates. There aren't. Your disagreement is with the state and federal government. And that, quite frankly, that's where your efforts should be directed. Thank you.
Thank you. Anyone else wishing to address the second privilege of the floor?
Mindy White, Clymer, New York, Bush Road, if you need the street. I think I would agree with what you just said, sir. However, I think, even though I appreciate County Executive Wendell, who states he stands against the governor's unconstitutional mandate, there is a real fear in my own small town of Clymer. The one restaurant we have has a fear of a $1,000 fine for every person who comes in. The health department, or excuse me, whoever regulates the food industry, I'm sorry, I'm not sure if it's the health department. That's real. So yes, we can write letters, and many of us do, but it's in our faces every day, and that makes a big difference for a small business in these small towns. I would like to say that I agree, this disease is very real. My husband, who is a volunteer EMT in our town, caught COVID by taking a patient while he was wearing all the gear to protect himself. Thankfully, they both survived. It is very real. And he also works as operating room nurse. But because of the mandates where healthcare workers, unless you're vaccinated, you cannot work, he cannot do many of the surgeries because that has now been shut down. And so now he's also working in the emergency room. My husband has been telling me day after day, it is a battleground there. It is terrible at WCA, our local hospital. The beds are taken up, but you also don't have the staff. It is crazy. They are overworked. It is just a disaster, and I can't believe that those in charge of these decisions, like our governor, have created this situation and making a bad situation worse. So please do your part to make it known that we need to approach this differently. Thank you.
Thank you.
My name is Diana Porevsky. I live in Gary, New York. Thank you for not reminding me again to put a mask on my face. I appreciate that.
May I interrupt you for a moment?
Sure.
You are a guest in the chambers of the Chautauqua County Legislature. I requested you to wear a mask. And I would expect and appreciate some respect for this chambers, these legislators, and my position. You may continue.
So I actually was going to stand up here and say thank you to PJ for his seemingly support of not enforcing the mandates. However, prior to waking up and speaking truth, I actually got paid to be a social worker, and I worked in clinical work, and I was a trauma specialist and all of those fun things. And so now I'm just a lunatic that stands on the corner with a flag and have people like this gentleman make fun of us for not having enough people here tonight as he walks in. And so, excuse me?
Are we going to go on record?
Go on record for what?
Are we going to go on record as ignoring the state mandate? As a body, are we going to go on record here? Because that's what we're doing.
Is it a law?
It is not a law. Mandates are not law.
Asking a question, be a point of order.
Legislator
Thank
Warren,
you.
please, you've interrupted one of the speakers.
Oh, go for it, ma'am.
Feel free to make that comment as another participant in the second privilege of the floor. Please continue.
Thank you. So one of the things that we know about in social work is that language is the first place of safety. So when you read in the paper that we're not going to support these mask mandates, and then you say things like the non-compliant patrons, I am not a non-compliant patron. I am a God-fearing citizen of the United States of America that has certain rights under God, of which the government is supposed to make sure that my rights are upheld, not tell me what I'm supposed to do with my body. not tell me that I have to get a jab that is experimental. And by the way, it is not FDA approved. The version that is FDA approved does not even hit the market until 2023 when the clinical trials are over. Everything that's being handed out right now is an experiment. Everything that we're sending you is factual information, and you are participating in crimes against humanity by telling our citizens to go out and get this jab. You're all going to be held accountable. It's coming. You're going to be held accountable. So it's your time to start doing the research, finding out how many people have died from this jab, what it does to the body. Follow Dr. David Martin, watch the damn video. He shows all the patents of the bioweapon COVID-19 and the bioweapon of the jab. It's toxic spike proteins. Stop telling your citizens to inject themselves with a killer bioweapon, and stop telling me I have to put masks on my children. My son was born 10 weeks early in the NICU on a ventilator. Do you think that I stood 52 days next to his side in the hospital, came home on oxygen so that I could not put a mask on his face so that I could kill him in society? Wake up and know your role. Thank you.
Anyone else wishing to address the second privilege of the floor? Chair. Legislator Ward.
Okay, my apologies for the interruption. I should have waited for your answer for the point of order. I'm sorry about that. That is my question, though. Are we in a position to go on record as ignoring the state mandate here in this chambers tonight? Because we are so far. I would presume that if we continue that is our position. I hate to begin anything that I say at the last meeting that I attend with the words "I'm disappointed," especially since Christine wrote such a beautiful letter, and in that letter in caucus she said that I'm always positive and to keep smiling. And I really appreciate that, Christine. Thank you for those words. And because of that letter, I'm just going to, I'm going to leave my disappointment and just say that I stand with the county's stance, the health department's stance that encourages folks to wear masks, that encourages all businesses, schools, and public gatherings to follow the health department guidelines and require masking and social distancing. I would encourage the Chautauqua County government to support those practices and save lives. Our hospitals, the simple fact is there are no hospital beds left in this county or near it. We are at crisis stage because people can't breathe. That's a simple fact. It has been said by the health department that if you're not in healthcare, you don't know that. Businesses right now are in an unfortunate and unwinnable predicament in that they're facing boycotts. They're facing I was at a healthcare facility who said they are being boycotted because of the stance the county has taken. I love you, PJ, but I fear that we have put the businesses and individuals in Chautauqua County in this unwinnable predicament. I would urge the county to change its stance on the state mandates. Thank you. Thank you.
Thank you.
Well, good evening, everybody. My name's Tim Smart, Jamestown, New York, Harding Ave, so District 11. I just wanted to speak with you guys very briefly to kind of make two sorts of points. Number one, I'm speaking on behalf of myself, but I think to some degree I'm also speaking on behalf of a group of people like me, and I'm not saying literally a group, but just that there are a lot of people that have been on the similar journey. So At the beginning of the pandemic, let's say March 2020, right around in there, whenever it was that it, it came down that, okay, we need to all work together as a community to flatten the curve. There was projections that there might be as much as, 2 million people that will die from this. And we were doing the best we could with the information we had, which was minimal, and everybody was reacting very quickly. And, I'm a pastor of a local church, so I'm immediately wrestling with, okay, where's the separation of church and state? How does this work? All of these things that we haven't really had to think about that much. And so we elected to go with the community response. Let's all work together to do what we can to save lives. Over the course of time, we find that the information, particularly that model of 2 million people, that was incorrect. We found out as we go that the testing, there's all kinds of issues, and we don't need to get into all of that. The point is that I am a representative of a type of person who had very little to do with off-year elections, local government. I don't want to be here. I want to be able to just vote and trust our representatives to do what they need to do. And but over the course of these last couple of years, my trust in the federal and state government responses, and in a sense, the local government response has gone down drastically. My trust in the system, the CDC, the FDA, the involvement of money, there's corruption. There's a lot we could say about that. It has gone down drastically. My frustration and anger with government in general has gone up. And I would always just say, I'm just going to vote and that's that, and leave it go. And so this most recent election, I went out and voted when I normally wouldn't if it wasn't like, a federal or state or, something, was going on. And I think there's a lot more people than we realize that are having these same sorts of realizations and waking up to a large degree to say it matters very much what we do locally. It matters very much, at all levels. And so the one point was that someone like me standing here, this hasn't happened in my whole adult life, to come and speak to the legislature. It's just the tip of the iceberg. I really believe that. It's anecdotal, but I believe that. And then I wanted to just ask a question, have us kind of think about that as we leave. To what degree is county government just a rubber stamp for the state? I don't know the answer. I really don't. I mean, I'm trying to understand. I have not even considered county government until this very, very recently. But one of the gentlemen made a point that, you should be upset with the state. You should be upset with the federal. That's really where these things happen. And I understand what your point is, because when the health department, this health department, came to our school and, threatening to shut it down and fine us every which way to Sunday and thousands of dollars here and there and everywhere, it was very aggressive. And they would reference the state, and the state references the CDC, and I have zero trust in them. And so what I want to just have us think about and consider is, to what degree are we just a rubber stamp? Do we have to do everything that the state says? And I think by definition, probably yes, mostly as a county. But is there some room for creative solutions? Is there some room to kind of do what we need to do in terms of compliance, but also not come at it as aggressively as, the people up the chain who are making some of these policies? And so, thank
Your
you.
5
Yep,
minutes.
okay, thank
Wrap it
you.
up.
Yep, that's all I have to say. So, thank you for listening.
Thank you.
There are 10 communications listed on the agenda this evening. There is another late communication that came in tonight, number 11. It's an email communication from Mr. Ben Schenk concerning COVID restrictions. Are there any items which a legislator would like to be read aloud?
Legislator Gold. I would like number 11 read, please.
Okay. It's addressed to the Honorable Frank J. Gould and the Chautauqua County Legislature. Dear Sir, I very much enjoyed our phone conversation on Monday, December 13th. Thank you for listening to my concerns and sharing some of your concerns with me. We hold many shared values. After sharing a cup of coffee with a cop, with Sheriff Quattrone, I decided to heed his advice and make attendance to the Chautauqua County Legislature meeting a habit. That was in October. November came around and I missed my first chance to join you due to a change in your meeting time before Thanksgiving. Now I face another hurdle, which is our governor's newest mask mandate and the enforcement of it by an unelected, bureaucratically controlled New York Health Department and its counterpart in Chautauqua County. I desire to attend this month's legislative session, but I refuse to wear a mask. This decision is based on the following information. There are effective alternatives to the approved narrative of mandatory masks and mandatory vaccinations. Though I believe the concerns expressed by our county health department are sincere, I cannot disregard the lawsuit filed by over 1,000 lawyers and 10,000 medical experts led by Dr. Rainer Fulmich against the CDC, WHO, and the Davos Group for Crimes Against Humanity. I provide a link below, hoping you will be concerned enough to educate yourself from a source other than the New York State Health Department. I cannot ignore the extensive resources of America's frontline doctors either. For your perusal, I have also included a link to their website. The last link I will leave you with is the Great Barrington Declaration, of which nearly 900,000 people worldwide have signed their names. These signatures include 140,000 infectious disease epidemiologists and public health scientists gravely concerned about the damaging physical and mental health impacts of the prevailing COVID-19 policies. I could send many more links, but I will spare you the inundation of information. My hurdle of being unable to join the legislative meetings is due to my holding to a principle of freedom and not bowing to a narrative whose foundation is built on greed, a lust for power, and total tyrannical control in New York State. States such as South Dakota, Texas, Florida, and others have adhered to the principles of freedom, allowing the people of their states to make their own health decisions regarding vaccination, masks, etc. There is no significant difference in levels of infection rates as compared to New York. I refuse the mask and the emergency use authorization for the experimental shot, of which one has been hastily approved by the FDA. I hope it will be said that the Chautauqua County Legislature stood against tyranny and defended the Constitution of the United States to which they pledged. In God we trust. Thank you for having this read by the clerk in my absence. Thank you for your service to our great country, in a great state, in a great nation. Ben Schenk.
All in favor, please say aye. Aye. Opposed, and we're adjourned. Merry Christmas.
You can show them where they are. You can show them where they are. Speaking up for all.